They informed me as an administrator that the case could not be managed at the hospital. So they needed to refer that particular case at DFK. While on their way, that particular pregnant woman died in the ambulance. So there was no way to respond to the hospital because there were no special doctors. In recent times, we have observed that there are several counties, Magiri, Riwaji, Venku, Venkebo, Maryland,
morning,
Nima,
for journalists where you might be joining.
All the counties that are mentioned.
My name is Prince Moban.
Special doctors have been made accounting officers.
Representatives, regular.
In the Ministry of Health have a specific policy that special doctors should be at the hospital.
City Hall.
And those doctors, they were trained by World Bank
authorities of the
government of Liberia. And they have also, because of the result of the minister, you may see the result
for the
that maternal death have gone the increase. Like Magini County, for 2024, they had 13,
he's a
Riwaji had 2, Venku had 3, Venkeba had 9, Maryland had 5, Nima County had 9, Basso had 19.
who are here.
Information system. And there are 51 community there, probably that the labor in the community that did not survive. And you know why it's happening? If you check the statistic, what is it for? Why is happening to our people? So I will take the microphone to Honorable Goswan for asking
the government design and get the people. Let the people go to the witnesses.
For affording us the opportunity to speak on this issue. While he has already laid the platform for the issue of maternal mortality at the Liberia Hospital and the issue of transfer of professionals from this facility and being transferred to county health officers, I also want to bring to the attention and probably the fact that the minister and the chief medical officers are here, probably to provide us with the understanding, because Mr. Presiding, we have noticed over the period of time, specifically last year, from records that are shown, the issue of infectious diseases have escalated. And it is solely because people that are using narcotic substances. My attention is drawn to those from the ghetto that, in every ghetto you have people that are doing injectables. They have the single-use syringe. But in these ghettos, they don't know anything about single-use. So you'll find thousands of persons using one kind of needle and syringe. It'll be injecting people in those places. We have a high rate in infectious diseases. Those are HIV/AIDS, tuberculosis, all the kinds of hepatitis, cholera. We are all on the increase. I brought this plan here because if care isn't taken into presiding, if care isn't taken, we just might have a pandemic in Liberia. Even the health practitioners will not be able to handle. Already we are struggling as a government country to address the issue of malaria and Lassa fever. And then we have a high rise of infectious diseases spreading throughout the country. So since they are here, I would think that they provide us pieces of information so that we will know what is actually obtaining and how they can be curtailed to be able to present smooth learning for our people, both in and hinterland in the city. Thank you for the opportunity provided.
Thank you so much. Now go to our witnesses.
So the Minister of Health is taking a stand to present a response to the concern raised by the two Grand Basel lawmakers. My name is Springs. Thanks for joining us.
Honorable Speaker,
Thanks for
Honorable
following.
Deputy Speaker, Honorable members of the House of Representatives, on behalf of my team and myself, I want to say thank you for inviting us to give clarity on some of the doubts that some of the members of this House of Representatives may have. The first representative said he had some concerns that specialist doctors were being assigned specifically at Monserrado County and a few other counties that he named. Let me give a clarification of what a specialist doctor. Currently, let me just tell you first, there are 570 doctors in Liberia, of which 193 are specialized, and 66 currently in residency training. So when you say a specialist doctor, that doctor, it means that they have gotten additional training in specialized areas. I also want for you to know that all medical doctors in Liberia, all 570, once you are trained, you have the skills.
Order, no speaker. Point of order.
Yeah.
What's the point of order? What's the point of order, Judge William?
Honorable Speaker, Honorable Deputy Speaker, colleagues. Our calling communication is very clear, including his expose. The minister should be responding to the issue raised by our colleague, and not to be lecturing us the different categories of who becomes a doctor and who doesn't become a doctor. I believe the issue, Honorable Speaker, the minister is out of order. The minister is out of order because she tried to lecture us, and we're not here to be lectured. When you become a specialized doctor, a residential doctor, the issues raised by our colleague, she needs to respond to that.
Sure.
I have two persons who died in my mountain. Look at my colleague, look at their language. She has to clarify those people. She has to clarify that. She shouldn't be lecturing us.
Please get the back over. Please get the back over. Continue with this now.
So, as I was speaking earlier, of the 570 doctors in Liberia, they're all surgeons. That's how the medical school works. And that's the skills of the Liberian.
Please approach the presider.
So, all doctors, so surgeon like CS, as the first speaker spoke about, the first honorable representative, or any medical doctor can do that. General surgeon, radiography, all 570 doctors that have license, they are trained to do that. When it comes to specialists, specialist means that you have more in-depth knowledge. It means that you can monitor other doctors. It means that you can train other doctors. It also means that you have the skills to be able to foresee problems in the medical field. You made specific.
Can we wait? Let them wait and lay an opinion. Information for second. distinguished colleagues, my information is this. Honorable Speaker, many of us have served in the executive rose to the rank of even ministers before coming in the house. We have specific matter that we are concerned about, and I think we do not have the luxury of time to go back to the classroom. I just want the minister to start to address the specific issue of concern as clearly indicated in the letter, and can end up by explaining all of those. We did not come here to come and learn who does what, how they do it. Thank you.
Thank you, Honorable Speaker. Yes. So, Honorable Speaker and Deputy Speaker, members of the House, it's not a lecture. I was giving a background. So, concerning the Monserrado County specifically, that he said OBGYN is heading the Monserrado County Health Team, because that was in the letter. In Liberia, Monserrado County has the highest maternal mortality. And how do you tackle a county with high maternal mortality if you do not have somebody with the technical know-how, with the skill? The Monserrado County Health Officer, she's an OBGYN, she's a public health physician, she teaches at a medical school. That's the kind of person you need to head that sector. She said in 2020, January when we took over, the maternal mortality in Monserrado was 27. This month, January, in the entire country, we have had 4. She goes to the hospital, she teaches at the various clinics, she trains the midwives, she even participates. Right now, she even asking that at Tuporo Health Center, we open a theater so she can be performing surgery, because she teaches ultrasound, she goes around in the various hospital and teaches. So she even now advocating us to have a theater at Monserrado County Health Office on Tuporo Road to open a theater so surgery can be performed there, but she'll be actively participating. There was a team that came the last time, I will not say which country they came from, and they visited the various county health team. They wrote a specific letter that I will show to you to her for administrative oversight that this particular young doctor had for Monserrado, and how there's improvement in the Monserrado County Health Team since she went to ascend to this position. That's the kind of person. In addition,
Please continue.
in addition, in the letter they
Please take note of the witness provide information to us.
I think there will be question and answer. That's what I'm saying.
There will be.
So, every step of the way you interrupt me,
There's a specific issue. Honorable Minister, please take that back. Okay. Let's continue, please. She's taking it back already. Please have your seat. Number 9. Please continue with this job. We're not going to entertain any disruption or any injection to the witness leg. Please continue with it. Please go ahead.
So, on the by the representative that at the EPR there is a specialist. EPR is where you do vaccines, and the specialist that is there is pediatrician. They are training vaccines all their lives. So since the pediatrician been there, the vaccination rate increased over 71% as compared to last year when we didn't have a pediatrician. Also, when we had another colleague that was there who was not a pediatrician, I did a counting talk, Honorable Speaker and Honorable Deputy Speaker. And most of the places I went, it was raining on the vaccines boxes. It was rainy season. When I entered the health facility where they're keeping the vaccines, you will see, visibly you will see a rain on the vaccines carriers. Once the vaccine becomes contaminated, if you do not have that know-how, it becomes a virus itself. If you reduce the efficacy of the vaccine, you're giving that child polio virus if you're giving polio vaccines. If you give him mucil vaccine, and that mucil vaccine, it does not have the temperature, the room temperature. That child has mucil right away. So the only way you will be able to understand the intricacies except you have the technical know-how. This person who is this doctor, he knows about vaccines, he got the skills of it, he's also an instructor. So who's the best person to please? Comparatively with other West African countries, if you go to Ghana, everywhere around the world, you will see these specialists are placed in the various places. They will take their best. After the president appointed me, so the president appoints a technocrat. I'm an OBGYN. I'm also a public health specialist, as well as I have a PhD in tropical medicine. So when the president appoints me, say, I want you to head the health sector, the onus is upon me to bring the best that will be able to advise and be able to implement the agenda of the president as well as that of the country. I know who can make the impact in the health sector because I've been there for years, and I know who I can work along with for us to be able to improve the health sector in Liberia. So that's the reason when it comes to the appointment of the specialist you're talking about. If you go to Ghana, you will see that the EPI is headed by a pediatrician. And quite recently, I went to Malawi, and usually when I travel, I ask my colleagues that I need to go and see how the health sector works. So when I went to Malawi, I asked, and I was going from hospital to hospital and asking, who hears this unit? Who hears that unit? And what's the name?
The witness presenting to us, some of you are listening, take note and be prepared to ask questions. So witness, you got 3 more minutes.
So now the second question from Honorable Oswald.
You got 3 more minutes, that is fellow.
Yes. So the Honorable Speaker probably is a teacher in me. So my apologies of being a teacher, but that's how I am. So the question raised by Honorable Oswald.
Are you okay? How about colleagues? You got 2 more minutes for the festival of complete presentation. Please continue.
So the question raised by Honorable Oswald that there is an increase in infectious diseases. I beg to differ. There are certain, he's talked about HIV and AIDS. So Liberia has one of the lowest HIV and AIDS rates. When it comes to hepatitis B and other infections, yes, there's an increase because of drug users. So that's why it's important that we tackle the drug users. and we tackle the drug abuse, so we cannot have people sharing with us. So if you look at our statistics in Liberia, as compared to around the world, we talk about HIV, we have a lower HIV rate. But when it comes to other infectious diseases, coming to hepatitis B, there indeed is an increase, because if we look at our statistics, you will see even the young population, some of them are becoming infected with hepatitis B. But we are doing some work on that, and later on, probably the chief medical officer will be able to speak on how far we work with that. We spoke with WHO to give us some vaccines, because the preventive measure is to vaccinate the population. So I think our next vaccination batch, that vaccine is supposed to come so we can do mass vaccination once approved.
Thank you so much. So, our colleague now, the floor is yours to present a question. We start with Obosoka. I think she addressed the issue already. So, Obosoka.
Our speaker, our deputy speaker, distinguished colleagues.
When the questions come, we can refer to
our minister. Thank you for the presentation. Let me go specifically to the issue. The first issue that was raised in the communication of our minister that I need some clarity on is that you are assigning specialized doctor by your definition, specialized doctors, specialized surgeon into administrative role. Case in point, in your presentation, you spoke about the head of Maserati, and then you explained how the person is knowledgeable and teaching and that. So my direct question is, are you assigning specialized skill set in administrative position? That's one. Could you be specific more when you talk about HIV rate low relative? Can you give some specific data on that in terms of start? In terms of infectious disease, when you talk about hepatitis B on the rise, can you please help us to understand specific actions? When you say we are taking action, what are specific action that you are taking to curb the increase in cases? Let me ask my last question now. What is the relationship? My understanding is that you are having a very difficult relationship with the Enfield, on Enfield alone. And specifically, Enfield established has certain role in that you are recreating some of the departments that are supposed to be on Enfield. You are recreating those and creating a confusion in the health system. I need some clarity on those questions. Thank you.
Okay. We'll take 5 questions from this side. The witness address it. We'll take 5 questions from this side. The witness address it. We'll come back to the second batch of questions.
Mr. Speaker, Mr. Deputy Speaker, and fellow colleagues, I want to say to the Minister, thank you for the presentation. I think one of the things that brought a commotion on the floor is the issue that was raised by our colleague from Grand Bassett. And following your presentation, I want to ask just this simple question. You have said to us that we have about 500 plus surgeons according to you. Out of the 500 plus surgeons, I think 100 out of the 500 are specialized doctors. My simple question to you is, do we have surgeons as medical heads for all the referral hospitals across the country? That is my simple question to you. Or is there any hospitals in this country that do not have a surgeon as a resident doctor? So thank you very much.
Excellent question.
Mr. Speaker, Deputy Speaker, distinguished colleagues. Madam Minister, I would like to ask you this question. How many specialized titles do you have in the family health division at the Ministry of Health?
Thank you. Go to our And we'll go so and then we'll come to Obumafi Joe.
Thank you. Madam Minister, when you were making reference to my inquiry raised, you said that but from the information provided, I don't know how different your explanation was from mine. I did say that the increase of infectious diseases is high in Liberia. Given the population of those of our citizens that are on drugs, we have over 1 million plus of our citizens on drugs. We have 5 million plus citizens. Over 1 million of them are on drugs, and the infectious disease is spreading within our population. How am I wrong? How am I wrong? The issue that we should be discussing is how can we find a remedy? How can we address the issue because it is high? According to statistics around, we are 20% of our population on drugs. It has the potential of going to 42%. We as a government is incumbent upon us that we start to address it because sooner or later, like I stated, we will have a health crisis here that the 500 plus data that you made reference to will not be able to address the issues when it comes to they will all be overwhelmed and it will spread across. So that's my point. And I will ask that you please address it so that all of us will know we are all representatives of the people, you from the executive, we from the legislature, we can address this issue. All of us go back to our district and be information provision to our people. That was why I raised that concern.
Thank you, Obumafi Joe. Then we allow the witness to address that part of the question.
Thank you, Honorable Speaker. Honorable Deputy Speaker, the Speaker Police. To our guests, I basically want to ask this question because I came from a district, Buchanan district, where we have our government hospital. And usually, patients by home, they always call them out to a sick in their medication. And with the sonar, I heard the president saying that all of our facilities, government facilities around the country, they are all equipped when it comes to drugs. I want you to provide us information and how truth is that information that the president gave to the nation, because we are suffering from that as a lawmaker, but our people calling us to help them. Thank you.
Thank you so much. The first batch of questions.
Honorable Speaker, Honorable Deputy Speaker, and members of the House. These questions are interesting questions and necessary to be asked. I will start from the last. When the president said there were drugs in all the hospitals, that's true. Indeed, the 4-quarter distribution went, and you can call any of these drugs. One time I spoke with some representatives, few representatives, they called me, and I was telling them, sometimes when your family member comes for you, just ask them, did you go to the hospital? Did you follow up? Because sometimes people, I don't know the reasons that they come and ask for money, but the drugs are in the hospital. Sometimes. But when they're there, you can just call it if you think what they are saying is
You can get the check, please. Let the minister address the question. Continue, please. She's gonna go. So you can do the new format. Please continue.
So if I'm speaking, what I'm saying is not true. We can just step right or call the hospital or call anybody on the county health team and say Dr. Koto says this or she said that. You can do a verification. So indeed, yes, for any hospital if they do not have drugs, if they were not giving drugs, the drug were not distributed for the 4 quarters that it should be distributed. Then
She's addressing specific questions.
is the increase, Honorable Goswa. I know you're the chair of the drugs and substance abuse in the house, and you very enthusiastic about the drug abuse. But the reference you are making that there's increasing HIV, comparatively asking to compare. In Liberia, the HIV rate is low in most of our West African countries. It's 1.5%, sometimes it goes to like 1.2, between 1.2.5. In Africa, comparatively it's 2.9%. If you go to Nigeria, the percentage is higher as compared to Nigeria. I'm not disputing the fact that there is an increased rise in drugs, and once there's an increased rise in drugs, it will be parallel to the increase in infectious diseases, because when people are high, they can have all kinds of maybe inappropriate behavior that may cause them to have infectious diseases. I'm not disputing that. I was just comparing it with our African countries around us. Indeed, yes, you are right. The family health division. Family health division is very critical. Very, very critical. If you look at family health, if you can get your family health division right in any country, the entire health sector is set up. Because they deal with maternal mortality, neonatal mortality, sexual reproductive health. If you go around the world, when they are saying your health sector is doing well, it means that you are doing well with your vaccination, it means that you are doing well with your family health division, which means your maternal mortality has dropped, your infant mortality has dropped. Before we had some doctors heading family health, I will not get the name of the doctor, the period. Maternal mortality in Liberia was 1,000 plus. They dropped it down to 500 something. After we changed the doctors and put non-doctors who did not have the skill, the technical know-how, maternal mortality is now gone to 1,000 plus. Anywhere you go for meetings, you as a Liberian, when other people are giving the statistics, you become ashamed sometimes. Sierra Leone right next to us, they now gone to 200,000. 200 per 100,000 Liberia. Now we are still in 1,000 in Liberia. How can we mitigate this? Can we still do things the way we're doing it to get the same result? No. So in family health division, we have the head, who is a reproductive specialist. We have another doctor who is an OBGYN, but he became ill. So on the table and do surgery, he only do writings. So we have those specialists there. And that's what you need for family health division. If you look at the statistics now, as it relates to before 2023, the maternal mortality is going down. It's actually going down. The services improved. When you go to the delivery room, there's improvement. And I hope this DHIS that is going to come up is going to reflect actually improvement in the health sector as it relates to maternal mortality. The next question is.
Hey, you can do a follow-up. You can do a follow-up. Go ahead, Overflow, you can take a follow-up. Take a follow-up. Overflow from the class attendees.
That's the question.
So, the surgeons as medical doctor here in the country was the next question. When you graduate from medical school, you got a license as surgeon and medical doctor. Because the 1 year internship that you have to rotate all the departments. Then after that, you go 1 year, 3 months in general surgery, 3 months in obstetric surgery, 3 months in internal medicine. So when you are placed in the counties, you are there to do surgery. If you have a problem as a medical doctor and you don't feel comfortable with a case, you call your superior. That's why you always should call somebody when you are before you enter the theater. If a new doctor who just graduated is entering the theater, and no, you do not have that skill, you call Dr. Potter, I'm going in the theater, I'm supposed to do a hysterectomy. Please keep on the phone with me. Please have somebody around. Or what should I do? All doctors are surgeons in Liberia. That's the Liberian law. They are generous, they are surgeons. They may not be specialized surgeons, but they train us as surgeons. They train us as surgeons. So yes. The next. All the hospitals are surgeons, general surgeons. Yes. Specialized. They have you are surgeon. If you look at our nurses, a surgeon as well as a medical doctor. That's what.
It's understood. The next, I will tell you out of the next.
So the next question, MPhil. Yes, I see. MPhil has a lot of people that are very silent, that be calling me, and I was called the last time I was on my way to Nima. So as it relates to MPhil, the head of MPhil, or MPhil falls under the Ministry of Health. There's one sector there. So when you are a sector head, MPhil Director General position is equivalent to a Deputy Minister's position. So in announcing outbreaks, it's the Minister of Health in consultation with the President that gave any announcement for outbreaks. So the MPhil Director has no right. The President has to consent, WHO consent, and then the Minister of Health announces the outbreak. The issue that I had with the MPhil boss is that he went to announce an outbreak without consultation. Announcing an outbreak has consequences. When you announce an outbreak, there should be a response already in place. MPhil is just like detecting, say you have disease here, oh you have disease, but who reacts to those diseases? It's not MPhil, it's the Ministry of Health. So the issue was that the MPhil boss went and gave an announcement about an outbreak that he was not supposed to. So when I called and I asked him, it is not within your prerogative. So the president, because the representative who asked this question is somebody in your office, and they did not consult you, and you heard him saying something, the judge went outside and started explaining, oh, my boss man said this one. You were called to ask why you did that. Did you get my consent? So that's the only thing that transpired between the MPhil boss and myself. That he announced an outbreak which was not his jurisdiction. It's the Minister of Health in consultation with the President because it has financial ramifications, it has political ramifications, it has, you can just leave it. It has security ramifications. All of those has to be taken into consideration before you can announce. So that's what happened. Besides that, nothing else happened. So whenever speaker, that's all the questions I was asked, and those are the answers that I have. Yes.
Follow up, please let me succeed.
Our Minister, thank you for the explanation. I think my specific question is that between your office and the director of this MPhil, we know that MPhil is an autonomous agency also that has a role to play with you. The act that created MPhil took or spin off certain department for honor you, give it to MPhil so that there will be collaboration or honor the ministry. Took it from honor the ministry and give some of those departments to MPhil. My understanding that I'm asking you, Madam Minister, that you are still replicating or recreating those departments and you have them under you does undermine the work of FPO. Is that true?
Okay, now answer my question and go to the second batch of questions from this side. We'll start with now, Kingston.
So, Honorable Speaker, so I wanted to ask your permission because again, I've seen a lot of honorable members saying, well, probably maybe we can have lunch later on and come back. Because my glucose level is rapid.
We can say we sit for water, but we need to
Yeah,
you don't bring the come out for this one.
yeah, maybe something or something like
Let's
that.
answer that question first now.
Okay, so
According to the nation.
clarity,
Honorable police, please allow us to answer the following question from Osoka. Go ahead, Rita.
can I answer the question? So you asked concerning duplications of functions. And I think what you're referring to is environmental health. Honorable Representative, the present agenda, the rest agenda, is for sanitation. When we took over the Ministry of Health, the sanitation in the Liberia hospitals were appalling. Even in health centers, the clinics, primary health clinics, the sanitation they were extremely poor. The sanitation, very, very poor across the country. There were some hospitals with all incinerators. Incinerators where they put the trash and burn. The placenta pits. Places with all placenta plates. In some places when I went to go to my tour, because a lot of people don't know me, I don't like to be in a loud life. So I will go to hospitals and they don't know me or to clinics. You will see when we talk about the vaccines, they will check out the vaccines, the shot all around. One specific hospital I went to, the rat was kind of competing with me while I was working. So if it has to do, you reach into it now. You ask questions. Yeah. So when I went, the environmental health, I call you one.
Where? You okay?
To answer.
Be allowed to answer the following question. Okay, all minister, please have a seat. Honorable police, hello. Honorable police. I will appeal. Honorable police. Honorable police, I appeal to you. We understand the minister, there's a health issue. We appeal to you so you can have water or some juice to thank you. Okay, thank you so much.
So to answer the question.
So,
If you do not have, I'm sorry, I'm just a teacher and I cannot divorce myself from being a teacher. So the thing is, for you to understand the question that you have to have a background. The environmental health unit was removed, quote unquote, from the Ministry of Health. And when it was removed from the Ministry of Health, the act of the Ministry of Health was not altered. NPO went and they did what they would have done and they moved the environmental health portion. The act of the Ministry of Health remains the same. It did not change. When I called, because the person, the pro-general of that act was the former Director General of NPO. When I called, I had to call and ask. I asked around, but how can we go in the hospitals, the Ministry of Health, the entire hospital burning? Who's responsible? They say, oh, you got environmental health people, they need NPO. No, but the act does not change. So who is responsible for the placenta pit? Who is responsible for the incinerator? So we have to reorganize our environmental health people to go in the various hospitals and start cleaning the hospitals. Is that wrong? Is that wrong for you to go and say, there's this group here, you people, they are already on their own Ministry of Health payroll. So reorganize them to go and ensure placenta plates being built. We reorganize them for incinerator to go around. Is that wrong? Is that a work of infill? To clean the hospital? So why can we clean the hospital if we don't have environmental specialists? That's the reason. So what am I doing wrong there?
Thank you, Minister. We're now going to take the second part of the question. Gustavo Ogisi. We say for one, we say for
My honorable Speaker, Deputy Speaker, my fellow colleagues, to the witness specific questions. I'd like to know from you in this public manner as to whether from the various health facilities or the various hospitals are authorized to ask the patient to provide fuel for the ambulance to commute to the referral hospital before services are provided to that patient. I'd like to know as to whether it is the policy or it is being authorized by your institutions that patient is required to provide fuel when needed. That's one. Two, I also want to know as to whether it's been authorized that the doctors, the nurses in the hospital should be selling drugs on their own to the patients. Because I have experienced that. I have bought drugs for patients in the environment at the hospital, and I also provided fuel. I'd like to know as to whether it is a policy or a program. So, these are my two questions, Honorable Minister. Thank you very much.
Next. I'm recognizing 8 questions from here.
Thank you. Thank you. Honorable Speaker, Deputy Speaker, the student police. Yeah, for me, when Honorable Speaker, Deputy Speaker, the student colleagues, whenever someone else take a stand, all right, so
you have a day. You have a day. It takes time. You
all right, so yeah, thanks for the opportunity for affording the people of district number 3 Bombing County the opportunity to make their point of issue. I have 3 questions to the witness, and my question is tailored for the science of healthcare. But before I ask my question, I got some disappointment. Let me say to the witness that her presentation, I don't know about the other people, but the people at district number 3 are very disappointed. Profession is the type of work. Career is the progression in that work. And job is the position in that progression. The witness must understand that she's here as the Minister of Health. And we are not talking about professional career. We don't care about it. So when the question are asked, they are asked on the basis of the people who send us here to represent them. And therefore, we need a question. We need an answer to the question directly. So as to make people to understand what they are here. Now, to my question, the 3 questions that I have to ask that I said from 3. I hope you are aware that I'm not speaking here at St. Jala, but I'm speaking here at district number 3, Bombing County. 55,000+ persons. Now, question number 1 for the minister. Are you aware or do you know about the TM devil? That is a traditional. That was something that I encountered in my district. And I want to know whether you are aware of them. If yes, what is your relationship with those people and the ministry? Number two, when you make mention of the supply of drugs, I only refer for you say about hospital. What about the clinics? And if you tell me that the clinics themselves are benefiting, like you mentioned the hospital, I will provide something for you that will tell you that it's not true. I just left from Swinmeka district where there are 5 clinics. Of those 5 clinics, as I speak right now, the issue of drugs is an issue. So to say that there are drugs in abundance in the drug clinics is direct. The next thing, what is the state being taken to tackle the issue of healthcare inequality in the country? Thank you for the opportunity and time.
Remember, breathe. Remember, breathe. Then James Colette. Please turn the back over to Remember, breathe.
I can ask my question. Thank you, Honorable Deputy Speaker, my distinguished colleagues. To the Minister, my question is, listening to you saying there would a place for pursuit of the state, international plenary. I don't know if it is. Listen to you talking about supply to the Liberia Hospital, the health center, and clinic. So I want to know, do we have a tracking mentor put in place that will be supply the clinic? How long the medication needs to last? Because for me, just last week, I had an encounter with few of my clinics. And the pregnant women was even complaining that they don't want to come to the hospital because even folic acid and paracetamol, they don't get it. They will give them shit to go and go and buy it out. So you even want basically we can go there and we can check on it. Because for me, I have a poison one. So I want to know with these supplies, I know when we had a crisis, I even used to intervene to send the supplies to my clinic. So I want to know if we have a tracking mentor, when was the clinic supply there, and how can we measure it? How long, as per the intake, the patient intake, how long the medication is supposed to last? Thank you.
Next, James Colette.
Yeah, Honorable Speaker, Honorable Deputy Speaker. Honorable Speaker, Honorable Deputy Speaker, distinguished colleagues. I have a great concern, Madam Minister. I am from Grand Cape County, to be precise, district number 3. Tewa district is included in my electoral district. And Tewa district is one of the largest districts in Grand Cape County with more population. And there is no health center in that district. They only have a little clinic that cannot even accommodate the population. If any town is helpful, then the surrounding villages, towns are added. So every day, pregnant women are going to attend the clinic. And they go there for delivery. When they go there for delivery, all of them cannot deliver by themselves. They have complications. Some of them have complications. We don't have no budget line for that district. We don't have no ambulance there. If the pregnant woman has complications and cannot deliver by themselves, they be given back to their family to take them to the referral center. And when they get to the referral center, they have to provide blood. They have to provide the medication if it's not available for the procedure. And so, in that process of gathering all those things, sometimes a person loses their lives. And now, but even in Papa, there are some towns like Bamada, Fono. Before carrying them to referral center, sometimes they lose their life because
We didn't have ambulance in Liberia. Many times when I'm there, I provide my car to be used as ambulance to take the patient. I don't know whether you are aware of that. There's so many deaths that are going on in Cape County with delivery. Those are the causes. I want you to check on that and let's find a solution. Thank you.
Mr. Speaker, I want to make a comment made by the minister with regard to the issue of the public health institute and that of the Ministry of Health. I stand still to be corrected. The minister who is legally inclined is here. Every legislation that is passed in the legislature, there is always a word at the bottom of that legislation. Any law standing to the contrary is not withstanding. And also in law called the theory of recency, means that the more recent law that was passed will now control or overpower the old law. So if those functions are created clearly in the Public Health Institute Act, and you still duplicating it, Madam Minister, I think you are duplicating the function of the Public Health Institute. That's the first correction I want to make. Now, proceeding to the point I want to raise. There are several points, Madam Minister, starting with the issue of please take note. Starting with the Assistant Minister for Vital Statistics. It has come to our attention that the Assistant Minister for Vital Statistics is the one that is currently signing the health certificate. And I think that is totally wrong. It is the responsibility of the Principal Director of Birth Certificate that should sign the certificate, and not the Deputy Minister for Vital Statistics. Besides, I also want to bring to the attention that people, doctors, like they say, specialized doctors have been brought to Monrovia when there is no doctors in the hospitals, and they are not only brought to Monrovia, but they are brought to Monrovia performing administrative functions. Let me name you few distinguished colleagues. The former CH of Bone County is currently the coordinator in the family health division. The former CHO of Bone County, Dr. Bablo, is a medical doctor, but she has been brought to Monrovia and she's performing currently an administrative function in the Department of Family Health Division. When her place, she was assigned no medical doctor to help the sons and daughters of Bone County. My giving CHO, Dr. Cecilia Jackson, is currently coordinator in the health performance-based finance department. When she served as she's a medical doctor, the Liberian people pay, the Liberian government pay her DSA at the drug and she was paid to go to school after learning